Congratulations on doing well with your test and moving forward to the long-term therapy. We're thrilled to play a role in helping you regain control so you can regain your life. The long-term therapy procedure or implant typically takes about 30 minutes. And many patients tell us it's easier than the test procedure. The IV sedation given by our anesthesia provider will make you comfortable during and after the procedure, but you won't have to go completely to sleep for the procedure. As we've discussed before, we place the little wire and battery completely under the skin. The wire is located under the skin in the same place as your temporary wire, a few inches above the tip of your tailbone. The battery is placed just under the skin in the fatty part of the upper buttocks, below your waistline, but above where you sit. And that's it. A little wire and a little battery. Everything is hidden under the skin, so no one knows it's there. And we expect you to get the same relief, or better, than you experienced during the trial. Now you're going to have two small incisions, one for the wire and one for the battery. The stitches for those little incisions will be hidden under the skin and dissolve on their own. We're going to place steri-strips over those incisions. They look like little band-aids. Then we'll cover them with a clear dressing that keeps them clean and dry. We want you to take the clear dressing off in about 5 days, but leave the little steri-strips on for another week or so after that. Now it's important for you to know that your care doesn't stop with us today. We're in this thing together, and we want to do everything in our power to make sure that you do well with it long term. In fact, we don't want you to ever have to find another urologist or gynecologist to help you with this therapy. If there's ever a time that you aren't doing as well as you would like, or if you just have questions about your therapy, please let us know. If we don't hear from you, our assumption is that you're doing great. Before leaving, our staff will provide you with the name, cell phone number, and email address of your personal patient success specialist. Going forward, this specialist will be your point of contact for all InterStim-related questions. Now, most of the time we can help you over the phone, but if for whatever reason we can't, we'll be happy to bring you back to the clinic. Or in some cases, your specialist can make a house call to take care of you. Now, we expect you to do very well with this therapy, but we also know that overactive bladder is a chronic problem with many contributing factors. InterStim is a life-changing therapy for many of our patients. For some, it completely resolves their issue. For others, it takes a problem that's this big and makes it this big. So you may not always be perfect. From time to time, you may have a bad day or a bad night. That's okay, but if you're having a string of bad days or nights and you need help adjusting your therapy, please reach out to your patient success specialist. We don't care if it's 6 weeks from now or 6 years from now. If you're ever having an issue, we expect to hear from you. Now you can call, text, or email your patient success specialist, and we'll make sure that you're taken care of. Thanks for allowing us to be a long-term partner with your care. We pray that you will do well with this procedure, have an uneventful recovery, and experience long-term success.